We'll start with a new topic, minor ailments. So what is minor ailment? In community health nurse, it's responsible to provide primary health care in the community. Treatment of minor ailment and emergencies is an important component of community health nursing. Nurse should be able to identify the signs and symptoms of patient and treat them according to the standing order. Minor ailments indicate slight illness and emergencies of small nature. If there is any small diseases like small symptoms also, like vomiting, diarrhea, nausea, those are the things, and minor injuries, accident. So for that, if we give certain treatment in the primary health center, uh, also called as it's a primary health care, then it is a service of the community health nurse to give these services. So what are the principles used in the managing minor ailments? Ensure safe and helpful environment to the patient. Safe and helpful environment to be given to the patient. Treat the risk or injured person promptly to prevent any possible complication. In case of infectious disease, take appropriate precaution to prevent the spread of infection. Keep continuous watch over the patient and vital signs during the period of care. If there is any kind of situation like serious patient, then you have to keep the eye on the vital signs during the care. Help the patient to get well soon as possible and in his activity daily living. So you should see that the patient will get soon and he will be able to do his daily activities. Use the opportunity of health education during the care. You should give health education. Always remember the limitation in providing the treatment or follow the physician instruction. Okay, always follow the rules and the instruction of the physician. Help the family members in coping with the situation and prepare them for taking care of patient at home. Okay, you should give a psychological support to the patient as well as the family, and you should help them to cope up with the situation. Respect the beliefs of the patient. If they have any belief during the treatment, then you should respect it. In case of serious condition, refer the patient without any delay. Okay, if there is any serious condition, you should refer it to the higher authority in the hospital. So what is the classification of the minor ailment? They are, first one is general minor ailment that include common accidents and emergencies which need immediate first aid. Okay, immediate first aid if the person is needing, then it is coming under general minor ailment. Those are injuries and falls, dog bite, burns, high fever, heat stroke, diarrhea, and fainting. And some are systemic minor ailment, that is under eye accident, foreign bodies, infections, poor eyesight, dry eyes, night blindness. And in the earache, foreign body in the ear, otitis media, discharges, and the deafness. In the respiratory tract, it's allergic rhinitis, common cold, sinusitis, sore throat, cough, dyspnea, chest pain, asthma. And CVS, it is hypertension, anemia, and RHT. And digestive system, toothache, stomatitis, soreness in mouth, constipation, diarrhea, indigestion, vomiting, abdominal pain, intestinal obstruction, and hemorrhoids. And urinary system, burning micturition, retention of urine, urinary infection, renal stone. And neuromuscular system, headache, backache, convulsion, epileptic or fits, and dysmenorrhea. Reproductive system, dysmenorrhea, heavy bleeding, sores and discharges, and breast lump. So those are the diseases and how we can manage it. The management of minor ailment. The assessment, you will take the history and you will do the quick physical examination. You will find the cause and you will make the diagnosis and you will plan for the care. Then you will provide the treatment and nursing care. Afterwards, you will evaluate the care and condition of the patient. If the outcome is successful, plan for the follow-up and you can discharge the patient. If condition doesn't improve or serious signs, refer to the hospital. What are the standing order? Standing orders are directions and orders of specific nature. On the basics of these, on the non-availability of doctor, nurses or health workers can provide treatment at home, hospitals or health institution and community. Should be followed in temporary basics or in emergency situation. Okay, standing order means it's a power of for the nurses and the any paramedical staff or the health workers other than the physician who can take the any decision on the spot. That's in the emergency situation or the temporary basis, and they can start the treatment. So objective here is to maintain the continuity of treatment of the patient, to protect the life of the patient or to resuscitate him, to create the feeling of responsibility in the members of health team. What are the uses? We will provide the treatment during the emergency, enhance the quality and activity of health services. We will provide the good quality services, strengthening of primary health services in the community, decentralization of the health responsibilities. Decentralization means that is in the primary health care and the community care you are giving. Developing the feeling of confidence and responsibility in nursing and other health workers. Protecting the general public from the quacks. If any problem occurs, you can protect the general people. So what are the types of standing order? The authorized doctor and the registered community health nurse jointly release standing order. They are institutional, general and specific. Institutional standing orders are standing order prepared with a view of the available resources, staff position and the objectivity of hospital. Difference will be there between government and the private hospital. Okay? It's given based on the resource available and staff position and the objectivity of the hospital, and there will be difference between the government and private hospitals. Specific standing order prepared for the trained medical personnel, who is graduated or post-graduated person. Technical knowledge and the special skills are required here. This order should compensate the need of a doctor, and such order enhance the quality of a community health nurse. Okay? To compensate the need of a doctor, the nurse can give a standing order. And general standing order, common man is expected to follow some standing order. Those are, in case of diarrhea, you will get the ORS packet. That's the kind of standing order. And standing order for treatment of minor ailments like fever, you will examine the vital signs. You will gather the information about the symptom like headache, nausea, vomiting, shivering, cold, running nose, allergy, skin infection, jaundice, fevers, cough. If there is any, you will notify it. Provide rest and light meal to the patient. Prepare blood slide to examine the malaria parasite. So you will go for the laboratory investigation. You will give the paracetamol tablet and lots of liquids. If the fever is more than 102 degree Fahrenheit, you will tap it sponge the patient. And monitor the pattern of fever and wait for 2 days, the pattern to be notified. If the fever is accompanied with the rashes, isolate the patient. So that's another diseases. In case of delirium, convulsion, unconscious and hyperpyrexia, accompanying the fever, refer the patient to the hospital. Okay? They should know about the delirium, convulsion, unconscious and the hyperpyrexia, and if there is any, you can refer to the hospital. And heat stroke, person suffering should be kept in the shade and in well ventilated place. Okay? Heat stroke because of the it's also called as sunstroke. Okay? Because of the dehydration, there will be a problem. And note the vitals, remove all clothes from the person and wrap in a wet sheet. If the patient is conscious, give him a cold water, mix salt and other cold drinks. Keep continuous observation over temperature as soon as referred to the hospital. Okay? Temperature to be maintained here, then you will refer to the hospital. And diarrhea, you will monitor the symptom of dehydration. If the dehydration is severe or the patient is in the state of shock, refer him to the hospital. Okay? Dehydration, there is a level, 3 level. If the patient is having shock, okay, state of shock, then you will refer him to the hospital. You will provide the ORS to the patient. Rice water, coconut water, lemon juice, light tea, banana should be given to the patient. Okay? It will hydrate the patient. If there is epidemic of diarrhea, sample should be sent for stool test. Okay? If there is an epidemic, okay, diarrhea, many people of same area is having the diarrhea, then sample of the stool to be tested. If cholera is prevalent, immunization should be taken. Food and water should be protected. Notification should be done. People should be educated about the control of fleas. Okay? They should ask the people, and you should educate them about controlling the fleas and about the diarrhea and the cholera. Burns, try to keep the burned body part immersed in the water. Check the spread of burns. Okay, you will immerse the patient body part which is burnt in the water, and you will check the spread of burns. If the cloth is stuck to the wound, do not try to remove it. Okay, do not remove, because skin will be attached and there will be tear of the skin. Rings, bangles, shoes, belts and other tight fitting articles to be removed. Do not touch blisters unnecessarily, because it will cause the infection, and if there is a breakage, there is again still more complication. Assess the percentage of burns and give primary treatment of shock if needed. That is fluid. IV fluid can be given. Give ORS if the patient is unconscious and not vomiting. Provide analgesic if required. Refer patient to the further treatment. And drowning, loosen the clothes from the chest. Okay, make the person lie on his abdomen and get the water after the lungs. Okay, you should give like a resuscitation. You should do, so that the water what is drank by the person when immersing or drowning, that will be come out. Okay? And resuscitate the patient immediately and send him to the healthcare hospital or center. And the bites, that's dog bite. Thoroughly wash the wound with soap and water. Use running water. Apply betadine or a tincture iodine. Okay, it's a first aid. You will apply the betadine after washing. If the wound is excessive, check hemorrhage. Okay, if the wound is very deep, then you have to check for the hemorrhage bleeding. Stitches should be done only after the 24 hours. Give TT injection. Do not kill the dog and observe for 10 days. Okay, if the dog is dead, then you have to go for the rabies vaccine and the treatment. Send the patient for ARV therapy, that is antiretroviral, anti-rabies therapy. And snake bite, make the person lie down. Do not allow to move. Okay, you should never ask the person to move. Find out the kind of snake, which snake have bite. Tie tourniquet above the bite and continue to loosen it every half an hour. Okay, you should tie it very hard and then you can loosen it every half an hour. Make a cut of 1 centimeter length and half centimeter deep at the place of bite. Try to absorb poison from the site. Okay, you should cut the wounded area in the plus mark, that is 1 centimeter into half centimeter. Then you will absorb the poison from the site. Okay, there should not be any wound in the mouth of the person sucking. Okay, if the person is having a wound in the mouth, then the poison will enter into his body also. So if the person whoever is sucking the blood or absorbing the poison, he should not have any wound in the mouth. Clean the place with salt solution, water or ice. Okay, console the person and send him to the hospital. Scorpion bite, remove the sting and put ice on it after thoroughly cleaning the place. Okay, after cleaning you should put the ice, apply tourniquet above the place of bite and remove it after half an hour. Wherever it bites, you should tie the tourniquet above the place of bite and you can remove it after half an hour. Give analgesic tablet and also the sweetened milk at the drink. Sweetened milk to be given to drink and analgesic can be given. If patient is in shock, send him to the hospital. Fainting, lie down the person. His head should be at a slight lower than the feet. Okay, little below level of the feet. If the person is sitting, keep the head bended between both the legs. Okay, and person should get fresh air. Once the person gains consciousness, ask him to take deep breath and give him liquid to drink. If unconscious, continue, refer to the hospital. And injuries and fractures, clean the wound with soap and water. Apply the spirit wound, the place of wound. Apply betadine solution and bandage the wound with sterile solution. Monitor the condition of the patient. Treat the patient for shock. If the patient is having shock, you should go for a treatment of shock. Immobilize the fractured area and give analgesic and the TT injection. These are the basic treatment of injuries and the fractures. Wound, you will wash it with a boiled water and antiseptic solution. You will apply the spirit around this wound. Remove the foreign body present in the wound. Bandage the wound using betadine. Give injection TT. In case the wound is large and needs suture or caused by bullet or weapon, refer to the hospital. Standing order for MCH care. Give tablet to check vomiting and nausea in early stages of pregnancy. Okay, If the vomiting and nausea is there, you can give a tablet. In case of toxemia of pregnancy, advise her restricted salt diet and complete rest. If the toxemia is there during the pregnancy, we can ask the patient to restrict the salt diet and complete rest to be taken. Send to hospital if there is any edema, APH and PPH, antepartum hemorrhage and postpartum hemorrhage, that is a bleeding. Okay? If the mother develops fever after delivery, try to ascertain the cause. Then keep newborn in proper warmth and initiate the breastfeeding. Convulsion in children, lie down the child safely on the bed, loosen the clothes from the chest and let the fresh air come so that he can breathe properly. Clean the secretion from his mouth and let the respiratory tract function properly. Okay? You can ask the person, or you can let the person to sleep in the left lateral position. In case of fever, give cold sponge and evaluate the cause. And the hemorrhage, lie down the person on back, take BP, press the pad on the site of bleeding. Wherever it is bleeding, you should press it, give him liquid, try to find out the cause of bleeding. Monitor the state of shock, and in case of bleeding or condition of shock getting out of control, send the patient or further treatment. Okay, if the bleeding is continuous and or if he is going for the shock, then you can send the patient for the further treatment to the hospital. Unconsciousness, lie down the person in a well ventilated area, remove dentures if he is having, clean the secretion from the mouth, loosen the clothes from neck, chest and waist, provide artificial respiration in case of blocked breathing. Try to find out the reason. Okay, you should ask the patient, or you should let the patient to lie down in a ventilated area in a lateral position so that he can breathe and there will be no complication for the aspiration. Sore throat, you will record the vitals, inspect for white patches. If it is present, signs or symptom of diphtheria can be checked and need for the hospitalization. Take throat swab. If pharyngitis, you can give a saline gargle. Give aspirin tablet if it is a pharyngitis. Advise honey syrup with lemon juice and hot water. If history of recurrent illness, need the surgery. Cough, find out the duration, type, color, consistency of sputum and weight loss if there is any. These are the symptoms of TB. So if suspected, you can ask the person to the admission to the hospital and you can investigate it. Advise the rest, give aspirin tablet and give steam inhalation. If there is an inflamed eye or eye discharge, you can bathe the eye with water and clean with cotton swab. Apply the sulfacetamide eye drops that is available in the clinic. Demonstrate cleaning and the application of eye ointment. Cover with sterile eye pad and bandage. Okay, you should cover it with the sterile eye pad. Refer if vision diminishes. Refer is to the ophthalmologist. An infection that is not responding to treatment or wounds and injuries. If there is wounds and injuries and the infection is not responding to any treatment, you can refer it to the hospital. If there is an ear ache or discharge, clean the ear. Apply sulfacetamide ear drops again. Give analgesic, and if not coming down, refer it to the hospital. If discharge is present, clean with boric acid and apply ear drops. If signs and symptom is not subsiding, refer it to the hospital. Toothache. If toothache without fever gives potassium permanganate solution, mouthwash, that is twice a day. Okay, 3 times a day you should give a potassium permanganate mouthwash. If fever is there, you can give a aspirin 5 mg for children and 10 mg for the adult. Advise the dental care. Encourage to eat amla, orange, lemon, guava, sprouted gram, tomatoes, ragi and bajra. Ask patient to chew claw with affected tooth. Whichever teeth is affected, you can ask the person to chew with that. Constipation, if there is any, advise more fluid and leafy vegetables. Discourage laxatives and purgatives. Okay, it's an unnatural thing, so you can ask the person to have more fluids and the leafy vegetable. If there is anemia, encourage to eat ragi and jalvi and advise dry fruits. Advise oral iron supplements. Get the stool examination for hookworm. If there is hookworm, you can ask the person to get stool examined and oral iron supplements can be given. If there is any bleeding nose, You should ask the patient to sit and head erect, bend forward, so that the bleeding will be less, and it will not move to the like there is no much bleeding. Loosen all clothes at neck. Ask the patient to pinch nose at the junction of hard and soft palate. Don't let below the nose. Check vitals. Apply cold compress and refer to the hospital. Okay. If there is any bleeding, you can ask the patient to have a cold compression so that the bleeding will be stopped. So what is the role of community health nurse here? She will take the history and she will do the assessment, find out the actions and the complication and any specification. Vitals monitor can be done. Identify the needs and problems. Nursing services under the standing order can be given to the patient. Implement the referral system to the higher authority. Informing authorities outbreak of disease. Keeping medicine kit ready. Representing nurses' viewpoint in meeting. Being careful about limits and ensure safe and healthy environment. So that's what about the minor ailment treatment. Let's see in the next class. Thank you.